section, we're going to talk about different intervention with children and adults and adolescents, actually. The first point about children is socialization. It's just very important because even in developmental psychology, we always just talking about that, the way like the child going to interact with their siblings, first of all, with their parents and with their peers, that actually impact their personality development, right? For example, children who have like more siblings, they are just more social. They can just get along with almost everyone compared to children who are coming from a family that's just, you know, they are just only child or something like that. It's just very hard to just, I mean, yeah, it's just kind of hard because like I'm like one of those people. So it's just kind of hard to just interact with people. You have to practice a lot. It's not impossible, but again, I'm just telling you, it's just a bit hard. But yeah, there are just some teachable moments in children's development. Those moments are like the best time for learning health practices. There are like some windows for vulnerability in which like they're gonna be some time that you're gonna be exposed to just bad habits or good habits probably. When it comes to teachable moments, for example, if you would just teach your child to just brush their teeth before sleep, they're gonna develop that good habit for I would say for the whole life, like they're gonna do that on and on. Yet, if you would just skip breakfast yourself and you wouldn't give your child breakfast at all, it's just very hard for them to start that from, for example, age 18, right? Because they didn't have breakfast the whole years like before. So how come they shouldn't start having breakfast suddenly? However, since we all know that breakfast is just very important for our physical development, after a point, your doctor gonna tell you you should have breakfast. So it's just better to just start from somewhere, to just teach our children to just have some good habits. Um, there are like some people, they are just at risk people. For example, if your parents, they are just kind of overweight or they are struggling with obesity, the possibility that you would also struggle with obesity gonna be higher than someone else who is actually coming from a family that they are not obese, if that makes sense. Another point gonna be, for example, if you are coming from a family that your mom is struggling with breast cancer, the possibility of you actually developing breast cancer gonna be high as well. There are like some benefit to just doing some intervention with at-risk people. For example, in families who are overweight, even parents before conception, they're gonna go to a doctor, a dietitian, and they're gonna ask the doctor how they could just prevent having a child who is overweight. Yes, there are some families and they are doing that. Yet, there are gonna be some problems with that as well. Those at-risk children, they are actually very defensive with that specific problem because like the whole time their parents, they will just monitor them, so they are just kind of sensitive and very defensive about that one. Another example can be a child who is coming from a household that mom has breast cancer. Just imagine this girl actually saw what their mom was just going through. So if they would be around their puberty and if they would just doing an intervention with them, they are already just developing that kind of secondary puberty characteristics. So they are very sensitive about their body image at this point and about like what might happen to them in the future. So like, and this can impact their self-esteem as well. So we have to just be very cautious, like extra cautious about whatever gonna happen when we are doing intervention with at-risk people. There are gonna be some ethical issues in intervention as well. For example, like I said, there is like intervention is good, but like there are some bad sides with that as well. And depending on the family situation, we should consider whether we should do the intervention or not. And like that kind of intervention, it's not all about parents. We should just ask children's consent as well. So there are like some good examples about health promotion behaviors in older adults. In general, it's very good if older people, they would just maintain a healthy, balanced diet and they would do exercise. Your book actually mentioned like two examples, one guy and one like female. older adults, they were just saying that how like small activities like chores or like gardening can just help older adults to just enjoy their life better and have like some sort of physical activities. Your book actually encouraging controlling alcohol consumption in older adults, but the fact is, in general, older adults, they are not very much interested in alcohol consumption, if you know what I mean. Like they are not that much, unless they would be alcoholic or something. Other than that, they already know about their own physical conditions, so they're going to be extra cautious about everything. I mean, majority of them, we are talking about majority of them, right? Some small habits, like some small health promotion behavior can go a long way. For example, getting a flu shot. It's actually flu shot. It's gonna actually help them a lot to just overcome some sort of bad disease, and being engaged like socially can help them as well. For example, just having your own, I mean, you're not old, but like if you have like older adults around yourself, just having like some sort of friend circles, it can help a lot. Oh, ethnic and gender differences in health risk and habits. It's just very important because like it seems like for some ethnicities, the possibility of developing some sort of disorders is just more, or habits or like bad habits. For example, in general, it seems like African American and Hispanic women, they are just more, they do have more tendency in being overweight for some reason. However, for example, Caucasian, they are not like that. But Caucasian also, they do have like some other problems. They are developing some other problems. Yet African American, they are not. Or Hispanic women, they are less willing to start like a smoking habits. Yet, for example, that kind of behavior is just more in other races. So whatever intervention you're gonna do, you have to definitely consider the community, the population, then you can just add on that sort of intervention. Another point here is some small intervention, even like sending text messages about like, hey, here is a good flyer about your diet program. It can go a long way, like even a text message or a daily reminder to just have physical activity. It can help a lot for a specific community. But the point is, whatever gender or whatever ethnicity that we have to consider the intervention based on them. For example, males in general, they are having more tendency for smoking compared to females. So if we are doing like some sort of intervention, we have to consider the population of men versus women as well.